Welcome to Ulosca channel. Access all WGU practice questions. Introduction to Health and Human Services practice questions with answers.
Question 1. Which of the following best describes the primary goal of health and human services? A. To maximize profits for healthcare facilities. B. To improve the well-being and quality of life of individuals and communities. C. To enforce legal policies in hospitals. D. To provide only emergency medical care. Which one is the correct answer? The correct answer is B. To improve the well-being and quality of life of individuals and communities. Explanation. The core mission of Health and Human Services is to support individuals and communities in achieving better health, safety, and overall quality of life. This involves preventive care, social support, mental health services, and resources that empower people to thrive, rather than focusing on profit or limited care scopes. Question 2. Which professional is most likely to work in human services? A. Mechanical engineer. B. Social worker. C. Civil engineer. D. Pilot. Which one is the correct answer? The correct answer is B. Social worker. Explanation. Human services is a people-centered field. Social workers fit directly into this role as they provide assistance, advocacy, and resources to individuals and communities facing challenges, unlike engineers or pilots whose primary work is not focused on direct social support. Question 3. Which sector is not typically part of health and human services? A. Public health agencies. B. Social welfare programs. C. Construction companies. D. Nonprofit organizations. Which one is the correct answer? The correct answer is C. Construction companies. Explanation. While construction companies may contribute indirectly, they're not directly involved in delivering health, social, or welfare services. Health and human services sectors focus on programs and organizations that directly address community needs. Question 4. Which skill is most important for professionals in health and human services? A. Welding skills. B. Empathy and communication. C. Advanced coding. D. Architecture. Which one is the correct answer? The correct answer is B. Empathy and communication. Explanation. Professionals in this field work with diverse groups, often in vulnerable situations. Empathy allows them to connect with clients on an emotional level, while communication skills ensure accurate understanding, clear instructions, and trust building in sensitive contexts. Question 5. Which of the following is a preventive health service? A. Chemotherapy for cancer. B. Routine vaccinations. C. Surgery for broken bones. D. Dialysis treatment. Which one is the correct answer? The correct answer is B. Routine vaccinations. Explanation. Preventive health focuses on stopping illnesses before they occur. Vaccinations are a prime example. They help communities avoid disease outbreaks, reduce healthcare costs, and protect individuals, especially vulnerable populations, from preventable illnesses. Question 6. Which of the following best defines case management in human services? A. Treating patients in an operating room. B. Coordinating services to meet a client's needs. C. Managing hospital finances. D. Conducting laboratory experiments. Which one is the correct answer? The correct answer is B. Routine vaccinations. Explanation. Case management ensures clients receive a coordinated plan of care. This might involve connecting them to healthcare, housing, counseling, or job training resources, and ensuring that services are integrated to address all aspects of a client's needs. Question 7. Which is an example of a federal health and human services program in the U.S.? A. NASA. B. Medicare. C. Department of Transportation. D. Federal Reserve. Which one is the correct answer? The correct answer is B. Medicare. Explanation. Federal health programs like Medicare provide essential healthcare coverage to targeted populations, such as seniors and certain disabled individuals, ensuring access to medical services without financial hardship. This is a core role of governmental health agencies. Question 8. What is the role of confidentiality in health and human services? A. To allow sharing of client details freely. B. To protect client information and privacy. C. To hide mistakes from supervisors. D. To reduce paperwork in agencies. Which one is the correct answer? The correct answer is B. To protect client information and privacy. Explanation. Confidentiality is an ethical and legal responsibility that protects sensitive personal and medical information. Respecting privacy fosters trust between clients and professionals, encourages honesty, and ensures compliance with laws like HIPAA in the U.S. Question 9. Which human services profession works mainly with children's welfare? A. Pediatric social worker. B. Paralegal. C. Airline steward. D. Geologist. Which one is the correct answer? The correct answer is A. Pediatric social worker. Explanation. Pediatric social workers advocate for children's rights, ensure their safety, and connect families with needed services. Their work often involves addressing abuse, neglect, educational challenges, and access to health care. Question 10. Which is an example of a community-based health initiative? A. Neighborhood vaccination drives. B. Building luxury apartments. C. Selling health insurance policies. D. Importing medical equipment only. Which one is the correct answer? The correct answer is A. Neighborhood vaccination drives. Explanation. Community-based health initiatives directly involve local residents to improve collective well-being. Vaccination drives within neighborhoods are proactive measures that reduce the spread of infectious diseases and improve public health outcomes.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.